Hi everyone, my name is Jasnoor.
I'm Annie.
Hi, I'm Sayam.
And I'm Shaan.
Now, imagine losing the ability to move freely through your community, home, or even just across the room. For over 1 billion people globally, that's a daily reality due to mobility impairments. While traditional aids like wheelchairs and walkers provide essential support, they often are not able to adapt to the user or the environment. That's where artificial intelligence comes in, offering smarter, more responsive technology. In this video, we'll guide you through our scoping review on AI-powered mobility assistive devices and how they're shaping independence and quality of life for adults with physical impairments.
To understand the current landscape, we conducted a comprehensive scoping review. That means we weren't testing a hypothesis, we were mapping out what's already there. We followed established research protocols called PRISMA SCR and ARCSCI and O'Malley framework. In short, that means we searched across 9 major databases to find peer-reviewed studies on mobility devices like smart wheelchairs, robotic walkers, and sensor-equipped prosthetics. Devices where AI is built in, not just something the user wears. We screened 574 studies for titles and abstracts, 382 for full-text screening, and ultimately included 39 that met our criteria. These came from 17 countries and varied widely in design methods and technology. We then analyzed them using something called the socio-ecological model, which is a framework that looks at individual experiences and how technologies affect caregivers, healthcare systems, communities, and even public policy.
So, what did we find? First, the majority of AI-powered devices were smart wheelchairs. Supervised learning was the most common AI model, and that's a type of machine learning where the system learns from labeled data to make real-time decisions, like avoiding obstacles or choosing safer paths. At the individual level, users reported feeling more independent, confident, and motivated. Some systems incorporated technologies like eye tracking or facial recognition to enable hands-free control. These tools were not merely functional, but they also served as a powerful confidence booster. However, challenges remained. Studies were only chosen if they used the English language, and many studies provided a limited demographic diversity among participants. On the interpersonal level, caregivers experienced reduced burden and greater reassurance as users managed devices more safely and independently. In some cases, caregivers were involved in co-designing the systems, enhancing usability and fostering trust. However, challenges remained, including adjusting roles between users and caregivers and the risk of isolation if communication and training were insufficient. At the organizational level, AI supported rehabilitation staff by tracking progress and personalizing care. However, barriers remained, such as limited staff training on AI systems and a lack of involvement from healthcare professionals in the developmental process. These challenges led to the underutilization of clinical expertise and hindered effective implementation.
From a community level, many devices showed strong potential in real-world settings, like homes and clinics, supporting rehabilitation in familiar and accessible spaces. However, factors such as poor lighting, uneven surfaces, cluttered environments, and background noise often interfered with their performance. A lack of standardized accessibility features and integration with existing infrastructure further limited their effectiveness and adoption. And at the public policy level, there were things that are still developing. There is strong potential to promote inclusive, tech-forward care systems and address long-standing inequities in access, especially for low-income and aging populations. These opportunities would help shape a more equitable and innovative healthcare landscape. However, progress is currently limited by weak regulation, underfunding, and a lack of focused policy efforts, which continue to create barriers for those in underserved and resource-limited settings. One thing that stood out across the board, while these technologies hold real promise, the research is still catching up. Most studies had small sample sizes, limited diversity, and short time frames, meaning we still have more to learn about long-term outcomes.
To wrap up, AI-powered mobility devices are not just tech innovations. They're tools that can dramatically improve autonomy and quality of life for adults with mobility impairments. But we can't stop here. Future research needs to be more inclusive, long-term, and grounded in real-life settings. And we need to push for policies that ensure everyone, not just the privileged few, can benefit from these advancements. Thanks for watching. If you want to learn more, feel free to check out the full study.